speaking of updating, we do on a consistent basis update you on the total case numbers as it relates to COVID-19. We tested over 137,000 people yesterday, close to 138,000 people yesterday. When we conducted those tests, 9,718 individuals tested positive for COVID-19. As I said, while many look to the day-to-day, we tend to look at some of these 7-day, 14-day averages. That's why we pair the average 7-day 9,881 number with yesterday's report on case numbers 9,718. Let's get under the hood on those numbers, take a look at them. I mentioned we tested close to 138,000 people yesterday. You'll see the average number of tests over the last 7 days, north of 124,000. We will, yes, continue to work to get those testing numbers up. I don't know many states that are testing as many people, but that, as my mom used to say, don't compare yourself to others. So we've got to mark a responsibility as the nation's largest state to do more, and I recognize our responsibility to do more testing. So does Dr. Ghaly. That's why he announced on multiple occasions our efforts in that space, including, by the way, the encouraging news on testing as it relates to the FDA finally moving on pooled testing. And so we'll be pushing that very, very aggressively. Know we're working collaboratively with Kaiser and Sutter as healthcare systems who've been incredible partners with our efforts to date. We also have incredible leadership at UCSD and notable leadership at Stanford and UCLA. I want to just make a personal point to thank Governor Gray Davis, who's been a real champion for some of the pooled testing efforts and has had strong relationship that he's been able to coordinate with and provide support of with UCLA in particular. And so you're going to be hearing a lot more about pooled testing. It's something we've talked about in the past. We finally got those approvals from the feds. Some are still pending, but we want to start moving. Quest as one of our national labs. They're going to be doing most of their pooled testing back east first. But that's not going to delay our efforts as we're going to pursue our own efforts here in the state of California. Dr. Ghaly will talk a lot more about that. I look forward to talking to you a lot more about that as well. So we're going to be more creative in this space. And then we may have a little bit of surprise related to a new strategy next week related to testing that I'm also looking forward to making public, a new partnership for more innovation in this space. A little preview, an announcement next week. 7-day positivity rate, 7.5%. Monday, when I shared this slide, was 7.4%. So the 14 days holding fairly steady. 7-day has been a little bit more challenging, 7.7 last Monday, 7.9 today, but 7.5% is the 14-day average. You can see where we were 2 weeks ago, 7.4% on this slide, 7.5 again, where we are today. Hospitalizations are increasing, but not at the rate that they were in the past. Let me be specific. 2 weeks ago, our hospitalization numbers, when I announced them, were growing over a 14-day period about 28%, 16% when I socialized hospitalization numbers a week or so ago. This week, we're putting, at least at the end of this week, it looks a 9% increase in hospitalization. So again, hospitalizations are increasing, but there is a decrease in the increase, if you're following me, meaning the rate of growth is beginning to decline modestly. That is nothing to jump up and down about. It's just a fact. Again, these are statewide numbers, and they mask the reality in different parts of the state. And I'm going to get to that, as we always do, with the monitoring list to only reinforce and underscore that this is aggregate data. And as you hear me say often, none of us live in the aggregate. We live somewhere in the state of California with different criteria, different conditions, and different realities as it relates to hospital capacity and the like. But 9% increase over a 14-day period. You'll see total system capacity still in that 9% of all the hospital beds. It's been relatively steady, 8%, 9%. It was 9% in Monday's presentation, still 9% in terms of total hospital capacity today, Friday. As it relates to ICUs, similar trend as it relates to the rate of increase. While things are increasing, a couple weeks back it was 20% over a 2-week period, then it was 12%. I think on Monday that I announced 11% is the 2-week admissions over a 14-day period in ICUs. And like hospitals, ICU capacity is distinctive in different parts of the state, and this is a point of particular focus for us as it relates to issues of ventilators, as it relates to some counties. And we talked about Imperial County in the past, but parts of San Joaquin Valley, now Stanislaus, and other parts of the state, the ICU question becomes a more important and impactful one to answer and to address. Ventilators that are available still, close to 12,000. Remember, ventilators, you see the ICU bed capacity. Remember what a ventilator does. At the end of the day, a ventilator, not easily, but with the incredible capacity we have in the hospital system and the surge plans, ventilators can turn to more access, more points of opportunity to increase the portfolio of beds that are available in our ICU system. There was some new reporting that came from the feds, or new criteria reporting, and that's why the number, we had about 17%, that blue section on this, which is the total number of ICU patients that are tested positive for COVID-19. It's 23% today. It didn't grow from 17 to 23% per se. It's just we had to use different number. They wanted to pull out the NICU beds, not just the ICU beds. And so we want to make sure that we are aligning with the updated federal reporting. So that's a slide you're very familiar with, and the 23% represents that update as it relates to that critical care capacity.